Yes.
Governor, do you all have an estimate on the number of healthcare workers and/or long-term care facility residents who would need to be vaccinated or would be eligible for vaccinations?
Dan, do you all have a? Yes. I'm going to let Dr. Lillian Peek answer that. Thank you for the question, Henry.
Good afternoon. We are still working on those estimates. We're working with the Virginia Hospital and Healthcare Association and CDC, but we estimate the two groups together are about 500,000 people.
Yes.
Alan Suderman, Associated Press.
Yes, Alan.
Good afternoon. How are you doing? I had a couple questions. One, how are we doing on PPE, especially in the Southwest? Two, when is the timeline for when we'll know when we'll have enough doses for nursing home residents? And three, have you made up your mind? Have you picked someone to replace Commissioner Christie, who just left the SEC to go to FERC? Thank you.
Any other questions, Alan? As far as PPE, the personal protective equipment, there have been some areas in the Southwest, Alan, that are on short supply. We've been in touch with them. We have the stockpile in Virginia. It's just a matter of logistics and making sure that we get the supplies to them. So if there's anybody across the Commonwealth, whether it be our clinics or whatever, if they'll let us know, we have the PPE in Virginia, and we'll continue to receive new supplies. So I would just encourage them to let either their local health departments or the emergency management offices in their localities know that, and we'll be glad to help with that. As far as when will we know when we have enough vaccinations, I don't know that we have an answer to that. Other than to know that they are manufacturing this as we speak. Obviously the time frame is going to be supply dependent, and as soon as we get the supplies here in Virginia, again, we've been working on this for several months, we will be able to distribute it in an efficient manner and also in an equitable manner. And lastly, the question was about the SCC. I was very proud to nominate Jamal Hudson several months ago to fill an opening. He's done an amazing job from all that I can gather, and now we have an additional opening in the SCC. I have been in communication with various people, particularly our legislators, and one name in particular has come to mind, and that's Angela Navarre. Angela was Deputy Secretary of our Commerce Department, and prior to that, Natural Resources. She's also an attorney. She is very experienced in energy policies, and so with the support of the legislature, at least those that I have talked to, I plan to appoint her to fill that vacancy, and that will be in the early part of January.
Yeah, with scarce supplies for vaccines up front, there's been some debate over whether healthcare workers or long-term residents should be the very first. With those initial 70,000 shipments you mentioned, the two groups make up about 500,000 people. So has the administration made any decisions about which should go very first and why?
Yeah, that's a great question. Lillian, do you want to address that? But we do have a committee, and Lillian can expound on that, but it's been addressing that very issue. Thank you.
So we do have a process in place to determine which groups would be of the priority groups, the larger ones, how we divide them into smaller groups while we have more limited vaccine. And we're working through that process now. We should have a decision by the end of the week.
Friday, when you submit that plan to the federal government, when those specifics will be outlined?
Yes.
Tim Barber, ABC7.
Hi, Governor. I'm curious, it looks like we might be seeing a post-Thanksgiving surge in the next couple of weeks. That seems like it might be likely. I know that we're waiting to see where the last regulations kind of fit us in the current COVID numbers, but if these numbers continue to rise, what kind of regulations might you be looking at next? I think it's important for families and businesses to be able to anticipate your next move. That way they could start planning. So what things would you be looking at? What kind of regulation?
Yes, I appreciate the question. The question was, we're already seeing numbers that are trending in an unfavorable direction, and his particular question was about a post-Thanksgiving increase in numbers. And, you know, my answer to that and what measures we would take to mitigate those increased numbers. And really, the way I look at this, and I get up every day, and it's all about looking at the data. And the first step is what's causing the rises in numbers. Where are we seeing those in the Commonwealth? And as I mentioned during my initial comments, they're happening where people are gathering in large gatherings, especially indoors. And they're also happening in places of worship. And so we're reaching out to our community leaders. We're reaching out to our faith leaders, and just asking everybody to be part of the solution. And again, that is just so important, especially for our hospital capacity as we move forward until we have the population vaccinated, that we keep that curve flat. So I don't have any particular measures to mitigate this that I am prepared to announce, other than to say that all options are on the table, and we will continue to confer with our team. We do that on a daily basis, and if and when we need to do that, I'll make those announcements.
How are you doing today?
I'm well, thank you for asking.
As you may know, people of color have had issues with medicine
Yes.
from years back. And
Yes.
there seems to be a small contingent of people of color who say they will not take the vaccine and telling other people not to take it. You kind of talked a little bit about the safety of the vaccine, but wondering if you could go maybe a little further with your views. And then on sidebar, the Campbell County Board of Supervisors have just voted unanimously to make Campbell County a First Amendment sanctuary county, if you will. Of course, as you know, this happens periodically or throughout the Commonwealth. And it may mean that law enforcement may not enforce some of your mandates, if you will. Wanted to get your response there.
Yeah, let me address the second part of your question, Andre. And, you know, I expect that law enforcement will be part of the solution here. And I would remind everybody in Virginia that we're not the enemy. This should not be divisive. It shouldn't pit one group of Virginians against another. The enemy is the virus. And so we all need to work together to attack the virus, not each other. And so if I have the opportunity to speak to anybody, I will reiterate that with my fellow Virginians. As far as your question about people that are perhaps reluctant to take the vaccination, we are certainly aware of that and hopefully as understanding as we can be. I want to give you a quick example of what happened with testing. And we had the same concerns and challenges with testing in some of our communities through Virginia. We planned and advertised for a testing day and site in Hampton Roads, and only several people, about 5 people, showed up. And so together we asked the question, what's the deal here? Why did this happen? And so one of our faith leaders actually said, I can tell you exactly what happened. People don't trust what's going on right now. And I'm not going to reiterate the history of testing, especially in African Americans as part of our history, but we certainly understand that. But anyway, with the faith leaders, what they did is they put together a video clip. We actually played it here. It was a number of months ago, and it showed them being tested, and really, I think, just emphasized to their congregations and followers that this is safe. And so we rescheduled that testing just several weeks later, and hundreds showed up. And so that's just an example, Andre, of how we're approaching this. But you're point is valid and is well taken, and trust is a big part of this. And so we'll work together. Our Health Equity Commission, Dr. Janice Underwood is with us today. We'll be reaching out to our community leaders, our faith leaders, and just as best we can make people comfortable with this. And I hope that once people see our leaders, such as myself, my family, the rest of Virginians that are, taking the vaccination and doing well, and also might be helpful to review some of the data and show that this many individuals have, volunteered and have been tested, and the vaccination has been proven to be safe, and it's also been proven to be 95% effective, and then we'll move forward from there.
Jimmy LaRue with the Suffolk News Herald.
Governor, thank you for taking my call. So many are feeling, hopeful about an impending rollout of one or more of the COVID-19 vaccines. You and other state health officials have been noting that it's going to take considerable time. I know you just said several months for those, who want to receive a vaccination to do so. With that said, and knowing that COVID-19 has especially affected older Virginians in nursing homes and assisted living facilities, and now, entering a period of spiking, COVID-19 numbers, coexisting now with flu season, what's being done to help people at these locations stay safe, from, COVID-19, and in particular, what's being done to ensure that these locations have the adequate PPE testing and staffing available?
Yeah, a great question. As far as the testing, as you know, we're testing now close to 20 to 25,000 individuals a day. So we're reaching out through Virginia, advertising when these testing dates and sites are available. So I think overall that's going well. I think the message that needs to go out as far as what are we doing to help localities where numbers are going up, so that businesses can reopen, so that our children can get back into the classrooms. We're really emphasizing to follow the guidelines that we have proposed all along. And the key in order to do that is to keep the numbers in the communities low, whether it be talking about hospital capacity or whether it be talking about getting our children back into school or our businesses, our restaurants, our entertainment venues, our movie theaters, to get them back up and running. The numbers in the communities have to be low. And right now, we're over 8% positivity. And so we know there's a lot of community spread, and we know that it's not safe to tell people that everything is okay, because it's not. And so this is not rocket science. It's not brain surgery, as I would say. This is about doing the right thing, taking responsibility, and following the guidelines that we know we're wearing these masks, washing our hands, keeping our distance, and not gathering in large groups. And that's what we'll continue to do. As I said earlier, we have all options on the table. We look at this data every day, and we will do what's necessary to take measures to mitigate this, and at the end of the day, our obligation and our responsibility is to keep Virginians safe, and that's what our top priority is.
Governor, pardon me, I know Dr. Peak said that estimate the healthcare group and the LTC is roughly 500,000. What are the, if you can share, I guess, the number makeup of those next groups, that high risk, the over 65? Like, how many people before we get to the general population, and when do you think that time comes?
Yeah, I will let Dr. Peak address that. One point that I will make before Dr. Peak talks about the numbers and when we'll be able to get to other groups is the pediatric population. And a lot of people have asked questions, well, when are we going to be able to vaccinate our children? Will it be safe? Will it be effective? And the answer to that is we need to do the proper studies, the research, and so the American Academy of Pediatrics has reached out to the pharmaceutical companies and really encouraged them to start doing that. And that will probably take a couple months in order to get those numbers. But it used to be years ago, and I'm old enough to remember this, that they used to take adult data and extrapolate that and say, well, if it was good for adults, then we know that we can use it in kids. And now we realize that children are different from adults. And so the FDA requires studies on children. And so that's in the process of moving forward as well. But that will be a couple of months. But certainly, we want to make sure that we want to get our teachers and staff members, we want to get them vaccinated, and that will help us, I think, get our children back in school. And Dr. Peak, anything you'd like to add to? Cam, do you want to just, I probably talked longer than I should have, but just rephrase your question.
Just again, you said that roughly that first group you're going to have to get through is 500,000 for the healthcare workers, long-term care facilities. Do you have rough numbers for, how much of the population in Virginia makes up that next group of the at-risk or the over 65, and what chunk is that general population, and when do we start getting to them?
Sure. So ACIP has released some guidance on the different phases, and phase 1A, as we said, is healthcare personnel and long-term care facility residents. The next two phases are essential workers and then people who have medical risk and who are over 65. So the ACIP only released more details about this first group 1A. So we're waiting for the FDA approval to go through. We want to make sure we understand what the definitions of the next groups are, and then we'll be working on those plans.
Just to add to what Dr. Peak said, if you do the math, you're up into the millions. I mean, 8.5 million Virginians. If you go through those high-risk groups before you get to the general population, you will have gotten to a number above 1 million, and just exact what it is. But it's significant numbers of folks who are simply over 65, and then those that have chronic conditions, and essential workers and infrastructure, et cetera. It's millions of folks. So it'll be a ways before we get to the general public.
Thanks, Dan.
Next, we'll go to Bill Atkinson with the Progress Index.
Thank you very much. Governor, good afternoon. You were talking earlier about the hospital situation in Southwest Virginia and how they are going to possibly cancel the elective surgeries for the time being. Early on in the pandemic, hospitals were facing several capacity crises, as we all know. Are we at the stage right now in the second wave? Are we heading in the same direction of a worst case of circumstances at the hospitals than before? And how can we apply any of the lessons we learned from that early time to addressing the hospitalization rate at this stage of the pandemic?
Sure. I appreciate that question. And I think for those of you that didn't hear it, he was referring to what have we learned and how we were making decisions across the Commonwealth to mitigate these increased numbers of our hospitalizations. A couple of things I would say. While we have an increase in hospitalizations, we are better, when I say we, the healthcare providers are better at taking care of these individuals. They have better medicines, whether they be monoclonal antibodies or remdesivir or the use of steroids. And so they're able to keep individuals off of ventilators much better than they were initially. So they're better able to handle those individuals that are in the hospital. The largest concern for our capacity right now is not so much bed space, it's not so much ICU space, not so much ventilators, it's the staff. And some of the areas in Virginia, especially in rural Virginia, just don't have the bench of providers that they need. And so the hospital systems, including Ballot, are looking at measures to take on how they can bring staff in to help with this. We talked last week about transporting individuals. Obviously, we'll work with our hospitals and look at staff issues prior to transporting. It's always better to have someone in a hospital close to their home. And then finally, what I would say, we made a decision early on in this pandemic to ask the hospitals to discontinue elective surgeries. And they were gracious enough to do that, and I think that helped with their capacity. We also looked at alternative care settings where we were planning on building other structures to take care of these individuals. Well, again, this now has become geographically diverse, so that there are some areas of Virginia, such as out in the Southwest where Ballad Health is, that are having difficulty with their staff, with being able to take care of the individuals. But there are other systems, healthcare systems in Virginia, that are nowhere near hitting their capacity. So rather than do a blanket change or mitigation, that we're allowing the healthcare systems to make those decisions. But I will tell you that we're working very closely with them. Our epidemiologist, our Commissioner of Health, Dr. Oliver, and our Secretary of Health, Dr. Carey, are in daily communication with our hospitals and with our healthcare systems to make sure that we're able to take care of Virginians who require hospitalization.
Off of that, Ballad has addressed the healthcare worker shortages. So is the state doing anything, from a state level to help address that? I don't know if that could include the National Guard, the Medical Reserve Corps. And then just to follow up, are we at the point yet where we are having to transport some patients from their home hospital system outside that?
It's a great question. I will let Dr. Carey address that. Thank you.
Thank you. The question really was, have we gotten to the point, and I may need to be a reminder if I've missed one, is have we gotten to the point, or what was the state doing primarily for staff? And we talked to Ballad Health last week, and we have continued conversations, and there's a couple of specific things. First, you mentioned the Medical Reserve Corps. We are seeing what are we don't have emergency room nurses and ICU nurses ready to go. There are a few, and that's terrific if they're able to be available, but can we perhaps, on the margin, backfill certain positions for a short-term basis? So yes, the Medical Reserve Corps option. So those conversations are occurring between Ballad, the local health directors, and the team here essentially over the Medical Reserve Corps. Second, there was a significant discussion about how to convert pre-hospital folks, paramedics, EMTs, under the direction of registered nurses. And there's a lot of flexibility actually under the Board of Nursing. So our Board of Nursing was connected to them, the leadership, Dr. Brown, the Department of Health Professions, and the team at the Board of Nursing to explore, are there any barriers that we could address to allow folks to come in from the pre-hospital setting to the hospital setting to extend the care that's provided. But there's a cost to that, obviously, because we hear from the pre-hospital folks that they're running into shortages as well, so that our EMTs and others are being stressed in Southwest. So those are the main options, is to look at repurposing healthcare personnel to the inpatient setting. But again, remember exactly what the governor said was exactly what the team at Ballad said. What we need from the state is not to deal with the downstream consequences, as serious as they are. We need help, and if you have it, send it. But let's get to the root of the root here. The root of the root is that, as the governor has emphasized, those simple behaviors of wearing a mask, keeping your distance, washing your hands, staying home when you're sick, are the way that we're going to turn this around. We know that we can do it, and the majority of Virginians are doing it well, but we need to double down on those efforts, even during the holidays, especially during the holidays. So again, there are things that we're doing, and we've outlined them, but we don't want to get too focused on that when the root of the root is the behaviors that we know we can change for ourselves, for our loved ones, for our health system, and for our neighbors. Critically important.
Are we at the point yet in any areas of the state where patients are being transported to hospitals out of their community for care?
Within Ballad, they are moving people around from one hospital to another. They try to keep them, from the discussion we had last week and previously. We do have across Virginia, we've got, as the governor indicated, 3,000 or 4,000 beds available, and in surge beds, another 4,000. But as we've indicated, it's the staffing that's going to run into shortages prior to that. So in those conversations, again, transportation would be seen as a latter stage event. So no, we are not moving them, for example, up to other regions, either of Tennessee or up to, for example, Carilion Health System or UVA Health System further up I-81. So not yet.
Thank you, Dan.
more specifics about how they might line up and whether you're getting any requests or inquiries about that from teachers groups or what have you, parents?
Yeah, Laura, I appreciate the question. The question was, are teachers requesting or asking about when they will receive the vaccination? And teachers, along with a lot of various groups, are inquiring about where in line I will be. And certainly, Laura, we've said all along, we want our children to be back in schools as soon as we can. And so to have our teachers and staff, school bus drivers, all these individuals, to have them have the vaccination available is very important. As far as, where they will be in line versus, let's say, food processors or people that work in grocery stores, people that can't work virtually at home, I would say that it's necessary for them to be in the workplace. We're still working through that, and we'll follow the CDC guidelines. But right now, we've gotten the guidelines for phase 1, and then we'll go into phase 2 and phase 3 as we receive that information.
And then we're going to just do one final one on the phone. Anna Lay, Virginian pilot.
Yeah, with the understanding that you will be following CDC guidelines to prioritize people getting the vaccine, I'm curious to know if priority will be given geographically as well, given that infections and deaths seem to be hitting the state harder than others. Also, a few days ago, you said that your hope is that by, quote, early to midsummer, everyone in Virginia will be vaccinated. Is that still the case today?
I'm sorry, if someone understood that, if they could
Yeah, she asked about regionally distributing the vaccine.
Uh-huh.
And then, can you repeat the second part of your question, please?
Yeah, of course. The governor said a few days ago that is that by, quote, early to midsummer, everyone in Virginia will be vaccinated. I'm just wondering if that's still the case.
Yes. The answer to your second question is yes, we are looking at, I hope by late spring, early summer, we'll, and again, it's supply dependent. So if we get the supply from the pharmaceutical companies, then we're ready in Virginia to distribute. And I couldn't totally understand, Lane, but the first part of the question was as far as the different regions.
Yeah, and I think Lily might have.
Thank you.
Can you hear me now?
Hi, we are working on our distribution plan to ensure that the vaccine gets to all parts of Virginia, and we're looking at doing that equitably, and so that is part of our planning.
All right. Well, thank you all again for being with us. A little bit lengthy today, but a lot of information, and I think a lot of hopeful information. As we said during our comments, there is definitely light at the end of the tunnel, but it's going to be a few months. So again, just please be vigilant and follow these guidelines and think of others. Think that we all have responsibilities in this. We're all part of the solution. So thanks for being with us today. And especially, again, I always like to take the opportunity to thank the press. We wouldn't be able to do what we do without your help, without getting accurate and up-to-date information to our Virginians. So we really appreciate you all being here and all the good work that you do for the Commonwealth. In the meantime, happy holidays to everybody, and please stay safe and stay healthy, and that's for your families as well. Thank you all so much.